When we think of the deadliest diseases in human history, we can imagine those with serious and frightening visual symptoms making the news headlines so rapidly and with so many victims. On the contrary, many of the so-called deadliest diseases do not kill as many people as we believe, nor do they rank among the top 10 causes of death in the world. Turns out the deadliest diseases are those that are slowly escalating. Of 56.4 million deaths in 2015, 68% were associated with long-term chronic diseases. Unlike rapidly spreading diseases with severe consequences, deadly and slowly developing diseases can be monitored and controlled. And through proper diagnosis, preventive care and counseling by healthcare personnel, patients can take steps to reduce the risk of consequences from their critical health condition. So let's look at the top 5 diseases that kill most people around the world every year. Number 1. Coronary artery disease. One of the deadliest human diseases is coronary artery disease, also known as ischemic heart disease. The disease is caused by a narrowing of the blood vessels due to damage, and the patient is at risk of heart disease. Symptoms of the disease include arrhythmias, chest pain and heart muscle failure. Fortunately, due to improvements in science, medical care and education, mortality rates from coronary artery disease have declined, although he is still the number 1 killer. Coronary artery disease can be overcome by maintaining a healthy lifestyle. Number 2 is a stroke. Stroke occurs when an obstruction or leaking of an artery of the brain occurs, where your brain is deprived of oxygen, and the cells begin to die within minutes. Symptoms of brain clot include palpitations in the extremities, difficulty walking or seeing, and general confusion. Strokes can be recovered, but if left untreated, they can cause long-term disability. But according to the U.S. Centers for Disease Control and Prevention, while 93% of people know that sudden numbness is a sign of stroke, only 38% are aware of other symptoms. Consequently, stroke is the leading cause of long-term disabilities. Number 3. Lower respiratory infection. Flu, bronchitis, and pneumonia are sources of infection in your lungs. So it causes viruses and bacteria to develop into the airways, causing major symptoms such as coughing, shortness of breath, or chest tightness and wheezing. Left untreated, lower respiratory infections can lead to death. If you get an infection, stay at home as much as this to give yourself a chance to rest and remove the infection faster, as well as infect others. Number 4. Chronic obstructive pulmonary disease. This condition makes breathing difficult in the long run. Emphysema and bronchitis are among the most common types of COPD. In 2004, an estimated 64 million people living with lung disease were registered. Number 5. Respiratory cancers. This disease includes cancers of the trachea, lungs and throat. Factors that lead to the development of this type of cancer include toxic particles, smoking, mold at home and other environmental toxins. A 2015 study indicates that respiratory cancer causes about 4 million deaths annually, especially in developing countries. Although those who smoke are at a greater risk of developing this condition, you can happen to anyone. So family history and regular exposure to environmental toxins also play a role. The most obvious way to prevent is to stop smoking, or not to start smoking. Regardless, there is not a lot to do with the development of this disease specifically to reduce your exposure to a toxic environment. You can also use the home and office air purifier, and wear a mask when out in bad air conditions.